Hi, everyone, and thank you so much for joining us for today's briefing. We're going to go ahead and get started. Today, we'll be discussing the findings of a new survey on the future of Medicaid, SNAP, and the Earned Income Tax Credit. The research you hear about today was conducted by the Program for Public Consultation at the University of Maryland School of Public Policy. At the bottom of your screen, you'll see a Q&A function. You can go ahead and start using that. You can use that anytime throughout today's program, and we'll go ahead and take your questions at the end. As you can see, speaking and with us here today is Stephen Cole, who is the director of the University of Maryland's Program for Public Consultation. For 3 decades, Stephen has conducted in-depth studies of public opinion on policy issues in the US and globally. So Stephen, I'll go ahead and turn it over to you.
Thank you, and thank you all for coming. Let me just say a few words about the kinds of surveys we do at the Program for Public Consultation. These are sometimes called public consultation surveys because we try to go beyond the most immediate, off-the-cuff kind of reactions that you might get in a standard poll. We actually give people a briefing on the issue. It's very short, but we get all the kind of key points in it. And then as they evaluate policy options, before they evaluate the policy options, they go through, they're presented arguments pro and con, and this is all reviewed to make sure that the briefing is accurate and balanced, and that the arguments are the strongest ones being made. We call this going through a policymaking simulation. We try to put them in the shoes of a policymaker as they make their decisions. So let me go on to talk about the findings of the new survey, and this is almost the okay, there we go. All right. That's part of the presentation that always makes me the most nervous. Am I going to get this up? So the survey was conducted April 4th through 9th with just about 1,200 adults nationally. This gives a confidence interval of a little over 3%. And the sample was provided by multiple online panels, and the sample collection and so on was managed by Quantify AI under PPC's direction, and everything was weighted and so on. We talked to them about the notion of poverty, the federal poverty line, and we told them what the poverty line was. We presented these numbers to them, and we asked them, what do you think? Do you think this poverty line is where it should be, or should it be higher or lower? And interestingly, a clear, consistent, but modest majority or plurality said that it should be higher, and 52% overall. 26 keep the same, 22% lower, with some variation by party identification. So one of the key areas that we explored was Medicaid and the potential for expanding into more states, and in general the level of spending on Medicaid. I'm not going to show you the whole briefing, but you're completely welcome to go. You can see the full questionnaire, and in fact, you can go through the process yourself and try it out. Have the exact same experience that the respondents had. We were addressing this question of whether the federal spending on Medicaid should be increased or reduced. We gave an argument in favor. The government has allowed the national debt to grow massively. This is an argument in favor of reducing, of course. The government has allowed the national debt to grow massively. Cuts need to be made somewhere. Programs like Medicaid are a major contributor to the deficit. Medicaid makes too many people, a quarter of the population, reliant on the government. And okay. A majority, 56%, found that very or somewhat convincing. Republicans considerably more so, 66%, Democrats 47%. And then we gave an argument against. Cutting Medicaid will throw millions of families off health insurance, including millions of children, elderly, and disabled people. Without health care, many will get sicker and even die. It will also lead to healthcare workers being laid off and hospitals being shutting down, especially in poor and rural areas. Well, that did substantially better. 82% found that very or somewhat convincing. Democrats a little higher, but Republicans very high as well, 78%. Now, you might go, oh, wait a minute, didn't the majority just say that they found the argument in favor of reductions convincing? That is normal. It's like people are going, oh, yeah, that's a good point. And then they hear the other side and go, oh, yeah, there's something to that as well. And that we think that's not a not a bad thing. It means people are deliberating, thinking things through, hearing both sides of the question. So that is normal. But what we're seeing here is that the arguments against reductions were found considerably more convincing. Now, we also put an argument in favor of increasing federal spending. Giving more people access to healthcare is a good investment. It increases people's health and productivity and reduces suffering from illness. Many households currently cannot get Medicaid because they make a little more than the limit, yet they are still too poor to afford healthcare. So they forego rent or food or go into bankruptcy, causing them to stay poor for longer. An investment in Medicaid benefits everyone. And that is very well, as 81%, including 77% of Republicans, 88% of Democrats find it convincing. The argument against: the federal government already spends an enormous amount on Medicaid. It is one of the largest government programs, taking up 10% of the budget. The federal government should be encouraging more people to take care of themselves, not rely on the government. Furthermore, if states want to cover more people, they can do so. The federal government doesn't have to be responsible for everything. And again, 55%, modest majority, find it convincing, more so Republicans, not less so Democrats. So when it comes to federal spending on Medicaid, what do you think? Do you recommend reducing it, keeping it the same, or increasing it? And 55% actually favored increasing. 49% of Republicans, 65% of Democrats. And combining the two, you can see that 81% favor keeping it the same or increasing. So the numbers favoring reductions are very small, 1 in 5 or so. Now, we went into the whole area of Medicaid expansion, and we divided people according to what state they lived in. And we told them, your state government has accepted the option to expand Medicaid, and explained to them what that was all about. And so what's your view? Do you recommend that your state government opt out of the program or continue to provide Medicaid to people making it a little above the poverty line and pay 10% of those costs? And the overwhelming majority favored continuing to be part of the program. We then asked people in states that have not expanded Medicaid, told them that you're in one of the 10 states that has not opted in, and what do you recommend? And 75% said they favored accepting the option to expand Medicaid to more people and pay 10% of the cost of doing so. A quarter favored continuing to opt out, and this included 69% of Republicans, as well as 82% of Democrats. So then we turn to SNAP benefits, looking at the benefit levels, the asset limit, food restrictions on discounts, and so on. And we told them what the SNAP eligibility requirements were or are: no more than 30% above poverty line, no more than $3,000 in savings. We come back to that asset limit of it's $4,500 per household, and work requirements at least 20 hours a week, working or training or seeking work if able-bodied and 18 to 54 years old. So. And then are these SNAP eligibility requirements looser than you expected, about the same as expected, or tighter? And on the whole, they came out more on the same as expected, a little more on the looser side than the tighter side. And then we explain more about how SNAP benefits go as income goes up, benefits go down, and then stop entirely when income is 30% above the poverty line. And we gave some examples of average SNAP benefits. An individual living alone with an average monthly income receives benefits of 170 a month, and then a single mother receives benefits about 530 a month. And should they be increased or decreased? Argument in favor of increase that people getting SNAP make very little and only get an average of about $6 a day in benefits. That's clearly not enough. Many want to earn more but can't find a job or a better paying job. Many are disabled or very old. Food is a basic human need, and it is simply wrong to keep people on the edge of hunger with benefits so low. And 83% found that convincing, including 79% of Republicans and even more Democrats. On the other side, the amount the government spends on SNAP is a lot of money, $94 billion last year. It should not be increased. The government should instead be encouraging people to get out there and try harder to get a job or new skills to get higher income. The government shouldn't be making it easier for people not to make the effort. Here again, modest majorities finding it convincing. See, there seems to be a repeating pattern, but 2/3 of the Republicans. So, we asked what they finally recommend. For people living alone and earning the average of 860 a month, reminding them the current SNAP benefits are 170, what do you think this amount should be? And 86% chose an amount above 170 a month. The median response was $250, raising it from 170 to $250, and not very big differences between the parties. For single mothers earning an average 1,150 a month, we asked what it should be, and 70% chose an amount above 530, with the median response being $600, from 530 to $600. We also looked at the asset limit, which we mentioned, which is 3,000 a person or 4,500, and the question of whether it should be raised. We should ensure that people receiving government assistance are truly in need. Taxpayer dollars should only help people who have exhausted all other means. If someone loses their job but has substantial money in the bank, they should not qualify for SNAP. It is not the government's responsibility to ensure that people can maintain their bank accounts. So this is the argument in favor of reducing the asset limit. And 62% found that convincing, 72% of Republicans, but even the modest majority of Democrats. On the other side, kicking people off food stamps when they save up some money does the opposite of what the government should be encouraging people to do. It makes it nearly impossible for people to save up enough to pay for education or skills that would get them a better job with more pay and get off welfare. It discourages them from saving money to face an unexpected cost, so they don't end up in debt or homeless. And that does even better, 80%, including 75% of Republicans and so on, more Democrats. So this theme of saving is a good thing. You really want to encourage that. That really kind of strikes a chord. So their final recommendation was that 49% favored raising the level of allowed savings, 39% keep it the same. So you don't have and Republicans, it was only 44% favored raising the level. Democrats 55. So you don't have a big push for either raising but you certainly don't have support for lowering the level of allowed savings, which was the original proposal that we were focusing on. So then there's, as you may know, talk about restricting SNAP for sodas, snacks, and desserts. And I'm going to go a little more quickly through some of this now, but the argument in favor is that, helping needy people meet their nutritional needs is one thing, but taxpayers shouldn't go to purchase junk food with no nutritional value, the rise in obesity and diabetes and so on. And this argument was found convincing by 72% and 78% Republicans, 7 and 10 Democrats. On the other side, just because people are poor does not mean the federal government should tell them what to eat. This requires setting a government bureaucracy to decide what counts and it's all very complicated. So it's just not worth it. And about the same number, 68% found that convincing, slightly less. And so then we said, okay, what's your recommendation? And we let them pick relative to all these options. And for sweetened sodas, 57% said it should be allowed, and even a slight majority of Republicans. Candy, 53% should be allowed, but less than half of Republicans or independents said so. Cookies, cakes, and donuts. So a large, yeah, that's everyone eats cakes, right? And that was pretty much a partisan consensus. Ice cream, even higher, and chips even higher. So, and this is interesting because we did ask about this some years ago, and last time there was support, there was opposition or support for having these limits. So that's an interesting test that there's been this shift. Now, there's also the possibility of having SNAP discounts on fruits and veggies, and the pros, they are likely to have positive effects and so on. And on the other hand, these discounts would, be costly. So do you favor or oppose offering this discount? And overwhelming 90% favor a discounts on fruits and vegetables bought using SNAP credits. Very bipartisan. On earned income tax credit, the big proposal out there right now is to expand EITC to workers without children. And the argument in favor is that it's one of the most successful anti-poverty programs. It encourages people to work by rewarding them for it, and so on. And just because people have children, don't have children, doesn't mean they shouldn't be encouraged, and so on. And 82% found that convincing, and very, very bipartisan. On the other side, EITC was originally conceived for families and especially to benefit children. It's not the government's job to supplement the income of able-bodied working people without children. Furthermore, EITC already covers many single workers without children who are under the poverty line. So that argument was found convincing by 61%. So, what do you recommend? Do you recommend that the EITC credit for workers without children stay at 630 or be increased to 1300, which is that's in current legislation? And 69% favored this increase, basically almost doubling it to 1300, including 63% of Republicans and three-quarters of Democrats. And then do you recommend the maximum amount that workers without children can make and still be eligible for EITC should stay at 8,500 for single people, 25,500 for married couples, or it should increase to 24,000 and 33,000. And two-thirds favored this increase to 24,000 for single people and 33,000 for married couples, including 61% of Republicans, 72% of Democrats. And then on raising the minimum age, right now it's at 25 years old, and two-thirds favor lowering it to either 21 or 18. And again, this was quite bipartisan. Now, I just want to mention that, you might say, well, that's interesting. This seems to be a substantial support for this kind of government involvement in addressing the needs of low-income people. And we did a series of surveys in the run-up to the election. We did them actually in 6 swing states as well as the nationally. And it's noticeable that we found this significant support on a number of other issues. I'm just going to quickly run through them. Making higher ACA subsidies permanent gets two-thirds support. Basically, one of the themes seems to be that a lot of the things that happened earlier, people are just wanting to continue. $40 billion for affordable housing for very low and low income households. 74% approval, additional 24 billion in public housing vouchers for low-income people, the disabled and elderly, 74%, and as you can see, it's clear majorities in all six swing states, and in every case bipartisan as well. Raising the child tax credit up to 3,600 and making it fully refundable for all parents. This is actually something that happened under COVID, and then people support resuming it. It was removed, and people want to put it back on. And again, this is sort of a theme that during the COVID era, there were more government programs addressed to the low income, and people seem to have gotten used to the idea and are supportive of it continuing. The federal government providing 25 billions to states for free universal preschool. Overwhelming majorities on that, very bipartisan, and the government subsidizing child care, so low and middle income parents pay no more than 7% of their income. 3/4 support that nationwide in all the six states, and again, bipartisan. So I think I will stop it there, and maybe we can open it for some questions.
Yeah, thanks, Stephen. Couple questions coming in. The first is, the survey finds broad opposition to Medicaid cuts across the political spectrum. What factors do you think are contributing to this widespread agreement?
Yes, there was really no demographic group that was not supportive, and I would come back to the theme that there seems to be a growing, the views of the ACA, Obamacare, have been getting more positive, and the combination of ACA and the COVID era increases in benefits, and people are going, yeah, this seems to be going, this seems fine, this seems good. They don't seem to really want it to go away. And in states that don't have the Medicaid expansion, they're very much leaning toward it. So it's I mean, and there is not a tremendous amount of debate about it right now. You don't hear very strong voices saying, this is a problem. So there's the kind of the public discourse has, in the elections and so on, there was not a big focus. There was not a theme against poverty programs or low-income programs or programs for the disabled. So it's just there seems to be a kind of new equilibrium around this issue.
Great. Next question. How do these findings compare with the policy proposals currently under discussion in Congress? Is public opinion aligned with policymaker priorities?
Well, all of these proposals are in some ways alive, active, current, and so we were really testing ideas for reducing, raising the asset limits, things like that, and so all of them are in play, and we tried to capture as many as we could. So some of them, for expanding Medicaid coverage to more states, yes. For raising asset limits, no. Sorry, lowering asset limits. There was not support for that. I can only just sort of repeat the main points, but I mean, all of these. The proposals are under discussion, so I can't quite say is Congress aligned or not, because not all the decisions have been made.
Were there any findings that surprised you or challenged assumptions about how the public views Medicaid?
There has been, historically this idea of a kind of negative attitude of people who are somehow getting government support. But you brought up Medicaid specifically. That has always been a bit of a different. There's kind of a carve out there. I mean, everybody needs health care. And so I think there's greater comfort. There is no talk here about having like a TANF proposal or anything like that to expanding TANF to so that people get actually monthly stipends to live on. But Medicaid is they're comfortable with it. Just sort of as a society, we seem to be redefining our the relationship between government and healthcare.
Another question, are there any areas where savings can be achieved in these programs?
Oh, gee, I'm not the person to answer that.
Um, okay. Can you talk a little bit more about this question is respondents evaluated arguments both for and against changing Medicaid funding? Can you talk more about which arguments resonated most and what does that suggest about how the public thinks about this issue?
Yeah. Well, I showed you the arguments and which ones resonated more, and as is not uncommon, both of them did. But the arguments in opposition to reductions was stronger. Now you might wonder, well, what would have happened if they hadn't gone through these arguments? And KFF, formerly Kaiser Family Foundation, did a survey, and they got almost on spending on Medicaid, and they got almost exactly the same results that we did. We don't. It's unusual for us to get a different result than a poll that didn't give the arguments, but sometimes it really is different. Sometimes people really have some misconceptions, and when those misconceptions get clarified, you do get a different response. But that was not the case for this. And as I said, the Kaiser results were a little more partisan, but basically the same.
Great. That's actually all we have time for today. So I'm going to go ahead and conclude this program. We appreciate you guys joining us today. If you'd like to learn more about the survey, there are also a couple of others that Dr. Poe, you've recently done. If you want to just speak to
Yeah.
those really quickly.
Yeah, I mean, in the last few months, we've done ones on foreign aid, on presidential powers, on energy and the environment, and with all of these, there's you can go through the whole policymaking simulation yourself. If you have students, you can have them go through it, and at the end, they can enter their address and then decide whether they want to forward their conclusions to their congressional representatives. And you can you also might find interesting that on the Voice of the People site, the results of all these different surveys have revealed a surprising amount of bipartisan common ground. And you can go to that, the Common Ground of the American People page, and there are now about 250 positions that have this bipartisan support, majorities of both Republicans and Democrats. So this isn't the only survey where we found this kind of bipartisan agreement.
Great. Thanks so much. And thanks everyone again for attending. We'll see you next time.